Welcome to Let's Talk Climate. I'm Rebecca Rear, Director of the Climate for Health program at ecoAmerica. And while we're all tuning in virtually, I am hosting from just outside of Washington, D.C., on lands shepherded by the Nacotchtank and Piscataway people. We are bringing you a special episode today, co-hosted with the National Environmental Health Association. And our topic is Live from NEHA's AEC, Together a Safer and Healthier Tomorrow. I'm joined by Dr. Steve Konkel, Principal of Konkel & Associates, an Anchorage-based planning consultancy specializing on climate and health, and U.S. Fulbright Professor of Environmental Health and Public Policy. And Dr. Natasha DeJarnett, Assistant Professor in the Christina Lee Brown Envirome Institute at the University of Louisville Division of Environmental Medicine. Thank you so much, Steve and Natasha, for being here today.
Thank you.
It's great to be co-hosting this episode with NEHA. So let's start by telling our listeners a bit about who environmental health professionals are and why they're so important to the climate and health discussion. Natasha, why don't you start us off?
Thank you so much. I am so grateful for the opportunity to be here. And environmental health professionals, we're in every community. And I firmly believe healthy communities don't happen without environmental health professionals. And we're often unsung heroes. And when everything is working well, we're essentially invisible. But there's so much that we do and so much value to it. According to the National Environmental Health Partnership Council, and Doug Farquhar represents NEHA on this council, they shared that as a fundamental component of comprehensive public health system, environmental health works to advance policies and programs to reduce chemical and other exposures in air, water, soil, and food, to protect residents and provide communities with healthier environments. Certainly, this all touches on climate change, and thinking about why we are valuable to the climate change discussion, our expertise is certainly part of that. Environmental health professionals are highly educated, with 95% of us having our bachelor's, master's, or doctorate degree, and 64% of us have the REHS-RS credentials. So we are also highly credentialed. So with our well-educated and well-trained professionals, we have the expertise in environmental health to understand that air quality, water quality, access to food, and the presence of disease-carrying vectors has an impact on the health of our communities. But we are uniquely aware that the climate crisis impedes these. And quite often, our communities aren't external to us. We're often members of our community. We also interact with members of the community and understand the unique needs by the nature of our work. So with our unique educational expertise met with our ability to understand and anticipate needs, we value community-wide interventions and policies. And lastly, I'll share that we care about the health of children. I think that's really important when we're talking about climate change. The American Public Health Association published a report on children's environmental health services, and they found that a majority of state health department websites offered educational information, technical assistance, and links to needed services related to the protection of children's environmental health. This tells me that environmental health professionals care about children's health and that of future generations. So this protection afforded to the most vulnerable lets me know that we are extremely valuable to the climate discussion.
I appreciate you bringing up children, because we, some of our most recent research actually showed, one of the results was that young people understand better than other age groups that climate change is going to impact their health the most, so that climate intervention, so climate solutions will have the greatest benefit to their health over their lifetime. And it maybe not a surprising finding, given that they likely have the most time left to experience the benefits of those climate solutions, but certainly engaging on climate solutions that advance children's health, but also supporting youth in leadership roles in the climate movement is an important part of environmental health overall, and I think climate solutions as well. So Steve, why don't you pick it up from there? Define for us who are environmental health professionals and what's our role in the climate and health discussion?
First of all, I'd like to say that I'm also grateful for this opportunity to join you from the great last frontier. It's a very, very special and unique place. And maybe in the future, it'll be a world leader in ecotourism. And so we always encourage people to visit Alaska and see the wildlife and those kinds of things. And so I'm on the ancestral lands of the Dena'ina Athabascan Alaska Natives, and American Indians and Alaska Natives in Alaska are a big part of what this state's all about. And in environmental health, we tackle all of those areas that Natasha mentioned, and we have an Alaska Environmental Health Association and a lot of collaborations with people. And also we have a key role in public policy and community planning. And so the state of Alaska is really very dependent on natural resources, and the regulation of things that have to do with the environment and public health are key aspects of our jobs here. And so as Dr. Dave Dijak, the executive director of NEHA, has stated, environmental health is a contact sport. And we're on the ground and we do a lot of environmental monitoring. And when I really want to go on a boondoggle, I always tell people I'm doing environmental monitoring. I'm getting out there and seeing what's in the landscape or experiencing different places. So thank you very much for that question, because a lot of people are always learning about environmental health. And with One Health and the 4 Ps of public health, population, pollution, prevention, we play a key role, and I think we're poised to contribute to solutions to climate change.
And I think that's a great quote about environmental health being a contact sport. And I think, because I think there's interesting parallels too in when we play offense and when we play defense. So we may, something to think about. But I also know another saying at NEHA, which is that environmental health is profoundly local. So tell me more about that and what listeners can do to plug into climate and health action on the local level. And Steve, why don't you pick up where you left off?
Okay, well, I think one can plug into climate and health action. The late Professor Joey Beck suggested that I volunteer to do policy analysis work. And although it took more than a decade, I ended up working as a legislative aide for the Alaska legislature. And I learned a lot about how the sausage is made, so to speak. And I've also gotten involved in things like Alaska lands issues years and years ago. And having a lot of very strong environmental values, I've looked for ways to express that. So I always encourage people to participate in those opportunities to assist decision makers or legislators, politicians, people that'll listen and educate them as to kind of what's at stake here. And the fact that we do have solutions, I think makes us a voice that's listened to. So yeah, it's profoundly local, and you start with the people that you know and the institutions you're in. And so you think global, but you act local. And you have a carbon footprint, and nobody controls your carbon footprint. You control your destiny and how you think about things. And if you think you can't do it, then you probably can't. But if you think you can do it, then you can kind of pat yourself on the back occasionally and say, hey, I rock. Look what I'm doing with my carbon footprint.
Yeah, it's definitely important to celebrate our wins for sure. And, celebrate what feels good, and I definitely think, being a part of the solution feels good. And I'm glad you mentioned local policy, because I think when we talk about advocacy, especially policy advocacy, people immediately focus on Washington, D.C. And that's important. And we need to keep the pressure up. Even when we elect climate champions, climate leaders, it's important. That's not a signal to us to relax. It's a signal to us to hold people accountable. And so I think it's important to stay vigilant about climate policy on every level. And I can definitely speak about that for Maryland, as well. I imagine there are some similarities in the pieces of legislation that are facing elected officials in Alaska and Maryland, but I imagine there are some very different issues that our states may face, and that it's really important to think about, advocating for the solutions that are going to impact your community. And the local legislators have a huge amount to say, have a huge amount of control when it comes to environmental regulation and permitting and air quality, local water quality, waterways. And so it is important to stay vigilant with the folks in DC, but to get to know your local legislators as well, because they really do. And your voice as an environmental health leader really does make a difference in those discussions. So Natasha, environmental health is profoundly local. What does that mean to you?
I absolutely love this quote, and I quote Dr. Dijak on this frequently, because not only is environmental health profoundly local, our climate experiences are profoundly local, even though they're global, because we have flooding in some parts of the US. We have wildfires in the Western US. In the Pacific Northwest right now, they're experiencing extreme heat, and it was extreme cold in Texas earlier this year. But beyond regional differences, we even experience differences by neighborhood, by community, where we have urban heat islands in some areas. And then we also have some communities that lack the resources for recovery and resilience. So it's different, especially at the local level. Things that environmental health professionals can do, you can partner. And as Dr. Konkel pointed out, we have great capacity to partner, and we have a lot to add to a partnership. So you don't have to know it all with the expertise that we have. And I encourage other listeners that aren't in environmental health, please partner with environmental health professionals. We can fill a void and fill a gap. But in environmental health professionals, we can partner with community organizations, and our boots on the ground appearance allows us to be able to do that, or boots on the ground presence allows us to be able to do that. We also can build relationships with researchers and academia that may have the resources to gather the data that can generate the evidence to inform your intervention. Or you can partner with foundations or think tanks that also have additional resources that can help support or build capacity. Also, if you don't work in an area that's directly related to climate change, you may consider how climate might influence your specialty and allow that to promote preparedness. So thinking around flooding and drought, consider food safety aspects. Or while we're experiencing an expanding number and geographic range of disease-carrying vectors and public health pests, we think along the lines of how vector control and integrated pest management may be able to provide preventive benefits as well. Think about water quality and sanitation that may be affected by flooding or also by drought. Also, things that environmental health professionals can do: join national organizations. Certainly, NEHA and others have climate change groups within their membership. And with NEHA's climate change group, they've been particularly active, have written a policy statement, have helped support the organization towards its 100% clean energy 2030 declaration, and then also develop strategies for more widespread member and affiliate engagement. So you don't have to feel alone. Joining organizations and working with other experts is very helpful. And even on a personal level, joining grassroots groups that are local to your community are also helpful. This is helpful to fighting eco-anxiety, finding a large group that shares your mission and vision so you don't feel alone in this very large existential threat. You'll have others to lean on to help support you. And then you can also further your education. There are many webinars and trainings that are available, many free of charge, that are accessible, but also certainly ecoAmerica's Climate for Health Ambassador Program is also a great way to further understand your voice and activate your voice in this space, which hopefully many that attended the annual educational conference participated in this.
Yeah, thanks for mentioning that. We had such a great training on Tuesday of this week as part of the AEC. Really high engagement, a great training. And really appreciated, being a part of that training with so many great folks at the NEHA AEC. And I'm really glad you mentioned partnership and collaboration. I think we know that majorities of Americans are concerned about climate change, but they don't necessarily think others around them are. And that can mean that you feel alone in your concern. And so we, as environmental health professionals, can step up and let people know, you're not alone. We're in this together. And sometimes it starts with a conversation, and that can be at the kitchen table, or it can be, as part of your professional association. So I love the practical advice you're giving today. And actually, along the theme of partnerships, we're getting a couple of audience questions. And Lisa asks, what are key messages and specific action recommendations for physicians and other healthcare providers to address climate change and other environmental threats for their patients? So for those who are healthcare providers, what might the environmental health profession advise those healthcare providers in talking to their patients about the health impacts of climate change they may be seeing? So Natasha, why don't you start off?
Certainly. I love this question, and I love that this is part of the thought process that's generated from this conversation. I want to empower physicians and other providers to be aware of how the changing climate will affect the people that you serve, the patients in your practice. There are environmental health professionals in the state of Maine that are educating physicians on seeing an increase in Lyme disease cases, and helping them to prepare their patients to protect themselves. And in doing this, it's showing that medical professionals, physicians, nurses are trusted messengers. So please be empowered in this, that people are looking to you for this information and they trust it coming from you more than they may trust it coming from me. So the studies that are out there show that medical professionals, nurses, physicians are among the most trusted health professionals. One of the key messages that resonates with me, and I'll quote Dr. Ed Maybach on this, is that climate change is real, it's happening now, but there is much that we can do about that. We collectively feel the much that we can do about it. So again, I strongly encourage joining local grassroots groups, because these groups have a wide variety of expertise, but having medical expertise and certainly public health expertise to inform the conversations along with environmental health professionals certainly helps the local grassroots groups.
Yeah, and Steve, what's your advice for physicians and other healthcare providers?
Well, my perspective on this comes from academia and schools of public health and founding of the College of Public Health at the University of Kentucky, where I was on the faculty for 5 years. And they have a very innovative school of public health there, but it wasn't without its stress between the College of Medicine, who didn't really think that the College of Public Health was on an equal footing. And San Diego State and other people had put together these programs. And there was a professor named Doug Scutchfield, who with Bill Keck has written a lot of books on public health practice. And they basically put into practice a wide-ranging public health and public policy college. And they reached out and they integrated across these lines. So nobody's got the magic discipline bullet. We need to collaborate to serve the needs of the people that really matter. So just like if you're in academia, if you say students count, but you don't believe it and you don't mentor students and you're just kind of going through the motions, then you're looking in the mirror too much. You really need to kind of be more like the people that you're trying to serve. And I think that collaboration is the way to solve complex problems. Maybe you have to disaggregate them and rebuild them back up. But even in Ireland, we envisioned an all-island research institute to connect environment and human health. And it had this awkward acronym called ARIHI. But you heard ARIHI and you knew what you were talking about, this environmental institute. And so I'm excited that collaboration continues, and you can't keep some people from collaborating, just like you can't keep some people from locking themselves in their office and not celebrating any other success because they think it's all about them. And it's not really all about them. It's all about us. And we are all in this together. And denial isn't just a river in Egypt. So.
And actually that was our last thought piece in the NEHA Journal of Environmental Health was all about, is denial our greatest environmental health threat? And we weren't talking about the body of water. So I think that's really interesting to think about. And for, I think physicians and healthcare providers also have a responsibility to, maintain continuing education and, get climate change and environmental health more embedded in the medical curriculum. There's a lot of great work going on in that field, with the Medical Students for a Sustainable Future. Society for Public Health Education is working on some different curricula. And I think that's an important thing that we can work on, and having that constant dialogue, and then asking questions, for patients, for providers. If you're coming in, get familiar with the type of symptoms, and that going back to local, knowing what the climate impacts will be in your region, to then know sort of seasonally what to look out for. Where I am in the DC area, allergies are really bad, and sort of seasonal allergies are longer. And so knowing, to look out for allergies, notices about air quality. I think knowing that, going back to that, environmental health is profoundly local, understanding the regional climate impacts and kind of what to look for, and then knowing those right questions to ask your patients when there are seasonal shifts, or, knowing that earlier on in the summer, a heat spike can be much more dangerous because your body hasn't acclimated, or knowing that on a hot and humid day, our normal cooling mechanism of sweat doesn't work as well because it can't evaporate, because the air is already so saturated with water. And just sort of really understanding some of those, key climate and health indicators to better serve your patient. Your patient is is a very important aspect of healthcare. And just sort of continuing on with that local theme, Steve, you're getting a question directed to you from Cheryl, who's tuning in from Idaho. And she's saying that the subject is indeed profoundly local, but also profound for those who are not specialists. She would appreciate a few practical steps on how to engage on the topic of salmon, forest fires, and dam removal, all complicated but extremely important subjects in Idaho. And so it gives you a shout out for reading some of your prior work, and appreciates any advice on engaging on those topics. And we know, forest fires in particular are important in many states right now. So what's your advice for Cheryl?
Well, Cheryl, thanks a lot for that question. As you know, I have a soft spot in my heart for Boise and McCall and Idaho and Sandpoint and points in between Coeur d'Alene and the St. Joe River and the resources in Idaho. And I grew up in Colorado. So I grew up with a lot of environmental values, and I see Idaho and Alaska as having a lot in common. So we could do studies to understand national forests and private forests and temperate forests. And what we'd learned from Alaska and Idaho is we have an incredibly dangerous and expensive and profound problem with wildfires. And so does California. And right now in Washington and Portland, they're, no pun intended, sweating it out a little bit. And so I don't think Alaska is going to be the leader in everything like heat waves. We may get some benefits, even if it's melting permafrost. Even there's 12,000 glaciers and 8 of them are advancing. So do the math. There's a lot of them retreating. We have James Blaylock has set up cameras, and we can see glaciers over 50 years, the exit glacier and others. We can see this stuff with our eyes. So it's not a scientific debate. It's what are we going to do? Because none of us wants to stand on a burning house and watch the flames engulf us. That's too late. So even though it's profound, I'd say I have to add to Rebecca's comment about you get involved locally. And in Idaho, if you can do it, anybody can do it, because the legislature, I was thinking of working for the Alaska legislature, and I did. And I was thinking of working for the Idaho legislature, and I found out I'd be up against a whole new set of things in terms of visionary state legislators and my values and how I could contribute. And that doesn't necessarily stop me, but it means we can learn a lot from each other. So I think you start with your own carbon footprint. You enjoy the things like the ski seasons and stuff that we have, and you do what you can to protect them, because at the end of the day, shredding groomers is a lot of fun. And I know a lot of people that are worried. And we got 708 inches of snow last year at the top of Alyeska. So I encourage you to come up and shred some groomers with your local Alaska tourist guide, available on demand in a place near you.
And Natasha, any advice for folks? Maybe if you don't have Idaho specific advice, maybe you know, sort of general tips for starting conversations on local issues that may be perhaps where solutions are in the political minority. What's your advice for folks?
The best thing I have is this amazing fact sheet from NEHA. NEHA just recently released a series of 7 fact sheets around climate and health, and they have one on wildfires. So I just added that there in the chat as a resource. And it lists recommendations for what environmental health professionals can be doing. So certainly encouraging education so that the word reaches the general population of how to protect themselves, when to protect themselves. Certainly, as we have all stated, being a part of local groups that will allow you to further be educated and understanding of the topic, and also give you access to the latest resources and best practices. And I think what's something that we need to look at in terms of wildfires and many other climate conditions are what populations are most vulnerable and most susceptible, and where can we shore up to ensure that the interventions that are created will benefit all populations? Great question. Thank you.
Yeah, and it's a perfect pairing of your answers too, because I think, you know, the steps, what we like to say, and what people tuning in for not the first time may have heard me say before, and maybe tired of me saying it by now, I don't know, but is that, you know, there are so many things you can do from the time you pick your head off the pillow in the morning to the time you lay it back down at night. There's so many decisions you make during the day, and that can, you know, have environmental impact and be more sustainable and be good for your health and for the planet at the same time. You know, we can make those decisions with our, you know, purchasing power but you know, it's very impactful, and we need to pair those individual actions with systemic change so that solutions are accessible to everybody. So it's really important to do both. And it makes us, you know, I've had experience talking to elected officials and, you know, advocating for specific solutions. And they'll say to me, what are you doing about it? And it's like, great. Okay. Here's what I'm doing in my home. Here's what I'm doing in my workplace. Here's how I have tough conversations with family members about it. You know, and I can say, when I say I'm doing it myself, I'm a more credible messenger in a way. And so it's definitely both, right? It's being, it's taking the actions we all need to take and making sure that those actions are accessible to everyone. And sort of going along with that same topic, you've both talked about in the past diversifying the environmental health workforce. And I know that's a priority for NEHA as well. So how is diversifying the workforce related to NEHA's health equity and environmental justice initiatives? And, you know, Steve, do you want to start talking about diversifying the workforce and sort of environmental justice as a core tenet of NEHA's work in environmental health?
Sure. I love that question. And I'm going to focus on the academic sector and my experience in early 2000s, 2003, at Eastern Kentucky University. There was a late Professor Joey Beck, and we knew this was important, so we founded the Task Force on Achieving Diversity in the National Environmental Health Workforce at Eastern Kentucky in partnership with the Centers for Disease Control. They have a National Center for Environmental Health, and we did a number of projects for them on drought, for example, when every drop counts, and we wrote the Healthy Housing Reference Manual, but we recruited minority students, and we actually were, University of Louisville and Eastern Kentucky were in fierce competition because you couldn't have any new programs in the state unless you had a certain diversity thing. And University of Louisville happened to be really good at that. So they were doing well with the pool, and we managed to sweet talk the state officials into basically letting us create a master's in environmental health science. And that part of it was that commitment we had to diversity. And we have a number of our graduates that sing our praises for that. But it was basically a Joe Ebeck production, who was always developing more innovative ideas in environmental health than the rest of us could keep up with. So he kept me very busy, and he was a big mentor for me. And I did everything Joe Beck usually suggested that I do, because it was just easier than fighting it until I figured out intellectually I didn't know what the hell I was talking about. So that's I think the academic sector is really important, but we need to look more like the people we serve. And there's people that are committed to this, and it's kind of like the Sunday brunch. The chicken contributed, but the pig was committed. So you're either, this is something that's part of your DNA, or it's not. Not everybody is student focused, but I like the fact that we're diversifying the profession, and these workforce issues have been carried on at NEHA for a good 2 decades. And I don't think anybody's more committed to this mission than Dr. Dave Dijak. And he has the academic experience, and he has the not-for-profit and the NACHO, National Association of City and County Health Officials, and the partnerships and projects things. And so the rest of us we just get on the train and say, how are we going to get this thing to the destination that we want to get to? And that means graduating people that are going to contribute.
Yeah, Natasha.
Excellent. And it's very important to hear that from the academic perspective. And so I'll share a little bit about the workforce perspective. So the Uncover EH Research Initiative, it's a partnership between CDC, Baylor University, and NEHA, reported that the environmental health workforce is 85% white, 7% African-American, 4% Asian, 3% Native American, and 6% Hispanic or Latinx. So diversity is lacking. That's my conclusion of that statistic. Diversity is lacking. And consider, does this sound representative of the communities that we serve? So that's part of the why. We're not representative of the communities we serve. And it's even less diverse when we go into the leadership areas of the environmental health workforce. So that's one part of it. But another part is that we have to acknowledge the reality of environmental racism. And I know this can be tough to hear, and this does not mean that you yourself are racist, but we have to understand that there are systems and even policies and practices that our field has engaged in that leave some groups out of the environmental health advancements. So when I was staff at the National Environmental Health Association, probably one of the things that I am most proud of in my career was that I was able to be lead author among an amazing group of folks on a position statement on environmental racism. So alongside Christina Ortiz-Gamina, Kaylin Celestin, and Joyce Dieterle. And what stood out to me in this process was reflecting on all of the amazing advancements afforded by environmental health that extended our life expectancy and our quality of life. That's clean, accessible water, greatly improved air quality since the Clean Air Act, and so many other interventions. The challenge is that the benefits of this great work has not been reached by all communities the same way. And so if these great advancements in environmental health don't benefit all communities, and if we believe in what we do, and if we're proud of these advancements, we should care if there are people who don't get the health benefits of these experiences. So it is our responsibility to examine the systems and policies that have hindered the delivery of our environmental health services, and thus that there are some communities that have not had the health benefits and life expectancy gains that others have. For example, here in Louisville, Kentucky, there is a 12-year difference in life expectancy between East Louisville and West Louisville. And certainly there are a lot of factors at play. West Louisville is more racially diverse, but also West Louisville is home to more environmental pollutant exposure. So in lieu of that and other injustices that we're aware of, through this policy statement, we recommended several recommendations for environmental health agencies, including very briefly, adopting statements on justice, equity, diversity, inclusion, upholding environmental justice, utilizing health and all policy frameworks to inform decision-making, requiring justice, equity, diversity, and inclusion training for staff, and then also utilizing hiring practices that encourage diversity in the workforce. So those were the recommendations that NEHA offered. And this comes under the guise of our service to advance the environmental health professional. And certainly health equity and justice are a priority therein.
And I appreciate in both of your answers, what's clear is that in order to dismantle systems of oppression, we have to actively work against them. And I think sort of in whatever setting we're in, and for organizations and for academic institutions, the question isn't about a statement. Statements are important, but it's about operationalizing that statement. What does that look like in practice? What is that belief, that core value, that moral imperative to dismantle systemic racism? What does that look like in the day-to-day work? And it's so important that we define that. And organizations are going on their own. Everyone's going on their own journey on how to answer that for their organization. And I think you've both given good examples about, from a professional association perspective, a workforce perspective, an academic perspective, how to do that. And so I think it's really important and encourage all of our listeners to, wherever you are in your journey, plug in. And let's do the work, because it will take all of us. And we do know, as you both alluded to, that dismantling system of oppression and racism benefit all of us, that we are then, allowing great brains to achieve their full potential and contribute to the ideas and solutions that we all need. It takes conversations with people of different backgrounds to make it happen. So really appreciate those answers. And Natasha, I'm going to stick with you for a minute. You have experience in both research and advocacy in environmental health. And I feel like sometimes people feel that they can't do both. If they're a researcher, they can't advocate because they don't want to be perceived as political. How have you navigated research-informed advocacy?
I love this question, and thank you for picking up on this. So this has actually been very intentional in my life. I had a faculty member when I was a student that noted that I had an interest in policy and encouraged me to do research that informs policy, to understand the science that informs policy. So this has been very intentional, and I'm grateful to have experiences at nonprofits where I had the opportunity to do little p policy, known as informing policy. So this, rather than the type of policy that involves lobbying by contrast. So I was able to look at the scientific literature, translate the research, and communicate it in audience-specific manners, whether it's webinars, reports, fact sheets, infographics, podcasts, the list goes on. And that is exciting for me, being able to take and translate that and make it make sense to different audiences based on their vantage point. So long story short, what I have done throughout my career is educate different audiences while operating in my skill set that is research or dissecting research. And so it's benefited me greatly to have a deep understanding of the science that informs policy. And at the American Public Health Association, this allowed me to support building coalitions and building movements on climate change and health. And at NEHA, I was able to utilize my science background to support the Climate and Health Program Committee on the development of the climate change policy statement that was approved last year, to help disseminate the results of the American Climate Metrics Survey, which NEHA works on with ecoAmerica annually. And then with also support from ecoAmerica, there was an emergency preparedness report on climate change that was developed. And we were able to utilize that to develop the new fact sheets that have been shared there in the chat, and really help distill and give digested information out that showcases the environmental health workforce role in many different aspects of climate change. So I'm so excited to see that NEHA has released this great resource. So with those experiences in nonprofit settings, I feel very uniquely positioned that I have and a deeper understanding of the needs of the public health and the environmental health workforces. So from the workforce to the public, I have found that storytelling is key to engaging beyond the walls of academia. And then also I've learned from the workforce that data is so valuable. Cities are calling for more local level data to inform decision-making. And so I'm very excited that I feel like a great example of this is our public-private partnership here in the Envirome Institute, the Green Heart Project, which that's also been shared through the chat earlier as well. And so the Green Heart Project responds to a policy need, the need to improve air quality. And the research teaches us that places with more trees and green spaces have better air quality and better health outcomes. So in partnership with the Nature Conservancy and the National Institute of Environmental Health Sciences, we are planting trees for healthier air. And because we're a research institution, we're able to assess health outcomes and air quality before and after tree planting. So I feel this project is a win-win-win. It's ongoing, but I still feel this is a win-win-win. It's good for the climate. It is great for neighborhood cohesion, and it is great for public health. So I'm particularly grateful for the opportunities that I've had to inform policy and to also contribute to research.
You know, so much of your story resonates with me. I, had the opportunity to go to get a master's in public policy or a master's in public health. I tell people all the time, don't do what I did. Figure out what you want to do and then apply to schools. Don't apply to schools and then figure out what you want to do. But it was a recession, there were, I didn't know what I was going to do. So I had the option. I had it in front of me. I always knew I wanted to do science and policy. And I decided to get an MPH, a master's in public health in environmental health sciences, because I wanted any policy that I advocated for, any piece of, education, advocacy, lobbying, whatever it is that I decided to do, I wanted it to be grounded in that health science. And I knew that I wanted, any advocacy that I did, I wanted it to be rooted in solutions that would improve health. And I wanted it to be rooted in the health science. And that has been a really useful narrative since. So get your master's in public health, everybody. And actually that leads us into the next question. And this one's for Steve. That, my understanding is that for the most of the past decade, you focused on teaching, research, and public policy related to the US portion of the Arctic and a major epidemiological association World Congress themed on climate and health held in Anchorage. So tell us, as Natasha just said, storytelling is very important. So tell us the story of how you got started in Alaska. And as you're, teaching, what advice do you give to your students getting started in the field of environmental health?
Okay, well, thanks for that question. It's nice to reflect on some of the things in the past decade, especially that choice to focus on the Arctic and Alaska natives, American Indians, and some of the environmental health challenges we have, which seem to be very big picture. We have 20,000, 25,000 people that don't have access to clean drinking water and sanitation through piped systems, community systems. And we have coastal and riverine erosion. We have, in the past, we were even used as kind of a test site to see if you could blow off hydrogen bombs to create new ports. But the radioactive element didn't sit well with some professors at UAF who also had political problems, that they didn't like radioactive reindeer. They liked their reindeer without radiation. So at any rate, the World Congress of Epidemiology came along and we recruited a keynote speaker named Tony McMichael. And on the back shelf, I have 3 of his books. And he was tremendously inspiring, gave me a bunch of his work, and then ended up passing away within 6 months after the conference. And so it struck me as, when opportunities come along, you have to grab them. I didn't really look at myself as a local executive to run this meeting, but the theme of the meeting was climate change and health. And we attracted 1,000 delegates from all over the world, and we got it done. So I think you need to be inspired and be inspiring. And so I got started in Alaska from chasing a ferry and San Francisco, I used to wait till 5:25 and bolt down the elevator and then run for the ferry. And that's how I met my future wife, running for the same ferry, although she daintily stepped on the boat and I had to do one of those long jump things and kind of land on the deck. So it was pretty impressive to watch. I think now they cordon things off to prevent that kind of thing from happening. But we came to Alaska for the better part of a month, and I wanted to go to the Bill Ray Center. They called it Fort Ray because he built a building so big that they wouldn't move the Capitol. And so I got lost and I went to the court building, and I ended up, as a result, getting interviewed as a policy analyst and working as a strategic planner for the fourth governor of Alaska, Jay Hammond. So I've been passionate about rural and remote energy, and I helped work on a program. I did the program evaluations and evaluated a pilot and an idea by Captain John W. Spriggs of the U.S. Public Health Service, where we now have drinking water and sanitation serving 9,000 people in those communities. And it makes a big difference. And then a pandemic comes along and it's even more important. And so I think with infrastructure and these kinds of things, where we all kind of have a constitutional right to a quality of life, which includes longevity and a high quality life. And I think we need to solve problems rather than say, well, coastal and riverine erosion, that's not my priority. Or I was all for this climate change stuff till I found out what it would cost to move communities. That's not going to cut it in my book. So we need visionary state legislators as well as to work locally. And we need a federal administration that at least knows which way the oil tanker ought to be turned, so to speak. So that's my long and short thumbnail of how I got to be on the great last frontier and ignoring how many winters I've been here, because I can't believe it. I never got a 7-year itch, but then I got a ski pass last year, so I'm kind of good again.
No, that's great. And I should also say that one of the reasons that we're hosting this with NEHA in July is that it's part of the annual educational conference, and there's great sessions going on, and that each of you have been a part of, and that, we're, bringing forth. NEHA has had a journey from having a climate and health session at their annual conference to having a full day of climate and health. And now they have a full climate and health track at their full conference, which this year was virtual and in 3 parts. But I think that can serve as a great example for other health associations, other associations who want to introduce climate and health at their conferences, which we encourage, highly encourage. We know there are other organizations who do and who have year-long themes on climate and health, and but there's great examples out there for if you want to get climate and health at your conference. Some of our other partners like Sophie had their advocacy summit a couple years ago, solely focused on climate and health. So the advocacy action was climate and health. APHA did their year of climate change and health. So those are great examples of professional associations. So definitely example, you're not alone in your concern or your want for action. And just holding up NEHA as a great example in their climate and health evolution. And believe it or not, we are at the end of our time today. So I just have one more question for each of you, although I'm sure we could continue this chat for much longer. But I'm just gonna, go back to something actually that Natasha, you said in the beginning about sort of being invisible, and that, environmental health is invisible because it's things go well. And when things go well and don't happen, which is because of tremendous environmental health effort, the victories are invisible. And so I just want to hear from each of you, sort of our lightning round question. What is one invisible thing that environmental health professionals do that make our lives safer every day? So Steve, why don't we start with you?
Okay, well, Rebecca, I'm going to take the liberty of, since I missed a key part of that question on my advice for students, it's find a mentor, acquire some experience, be a bulldog, pursue your dreams. Better world is the 4 Ps of population and prevention and pollution and poverty. Go for stuff, think big, think like you're young. That earlier comment you made about children seem to get it, and young people really get it, and they don't know yet that they can't change the world. So go out and get her done. And always be a learning animal. And so that's my advice now on this invisibility thing. we don't chase ambulances. We're not New York Police Department, the Blue Bloods responding to calls. We go about our work and we're embedded in the environment. And I would say we drive the maintenance and creation of healthy, sustainable communities. And we do that through community planning and engagement. That's why I love my planning experience. For my master's, I went actually for a master's in city and regional planning. And Harvard and MIT had really good planning departments. And I've always found that planning background. I'll put in a plug for that. So I think, we need to engage decision makers and other people in sustainable development and in climate change. And we have the solutions. It's kind of like we have the meats or whatever, we got the goods. And so, let's put pedal to the metal and let's not set goals all for 2050 and say we can rest on our laurels for a decade. We're coming out of a pandemic, and this is the time to be a little bit more visible, to make a little bit more noise, and maybe even say things that are bold about what is and isn't sustainable. And when you're in a state like Alaska, that's going to be a conversation starter, all right, if you want to redesign the Alaska economy. But ecotourism is a winner, so experience it for yourself. And I promise not to make too many grizzly bear jokes around you. I ran into 2 young ones fishing on my last trip to the Kenai, and they were born at night, but it wasn't last night. So let's put it that way. I
was born and raised in Baltimore, so I'm a city girl through and through. I don't know what I would do if I ran into 2. I can honestly say I have no idea. I have a whole lot of ideas for climate solutions. I have no idea what I would do if I ever ran into grizzly. So I'll get some from you.
You need an honest guide, and so you can trust the honest guides, and you can also trust my Athabascan friends. They I guess they can smell grizzly bears. I don't know. It's all good.
All right, Natasha, over to you to close us out. What's the invisible thing environmental health professionals do that keep us safe every day?
This is hard because, as I pointed out before, so much of what we do is invisible, but is life sustaining. And I'll channel Dr. Dave Dijak for a moment. He frequently will say, did you brush your teeth this morning? You can thank environmental health for that. Did you take a deep breath when you woke up today? You can thank environmental health for the clean air and the clean water. We provide healthy community designs. We also support justice. We support equity. But the thing I'll highlight that is invisible in what we do is our ability to partner across sectors. We work with urban planners, epidemiologists, engineers, and others effectively to help ensure the delivery of these life-sustaining services that environmental health provides. So that's what I'll highlight. But I will also give a little bit of unsolicited advice. Let us stop being invisible. Let us engage in storytelling and share our successes more, where we avoided water contamination, where we prevented an outbreak through restaurant safety practices. Let us showcase those things that were prevented because of the great work that we've done. And I just want to thank you, Dr. Konkel. I absolutely love learning from you. And Rebecca, thank you for your incredible leadership in climate and health.
Well, thank you both. And I just, this is our signature on our letter to our love letter to environmental health professionals everywhere. Thank you so much for everything that you're doing. This episode is for you. This, and just hopefully we can work, continue to work together in partnership and collaboration. We're working together to the climate solutions that we all need. So, with the bold ideas that it's going to take to get there, and the energy from the youth that we need to get over the finish line. So just, Steve and Natasha, thank you so much for this wonderful episode, for the ongoing work that you're doing, for being a part of this co-hosted NEHA episode. Really appreciate it, and appreciate your thoughts today and the work you're doing on an ongoing basis. Love working with you both. Thank you so much. Like I said, I can't believe it. We're at the end of our time today. I know you've inspired our listeners to act on climate to improve our health and our family's health. For all of our listeners, please click on the link to the survey when this webcast ends to provide your feedback. If you're watching this on YouTube, check out the description below to let us know what you think. Engage with us online with the hashtag Let's Talk Climate And be sure to subscribe and follow us for the latest thought leadership resources and episodes on climate action and advocacy. Join us next week on Thursday, July 22nd for the Let's Talk Climate episode, Ready for the Storm, Faith Communities Are Key to Climate Resilience, with our Blessed Tomorrow director, Anita Fett-Cruz, as she is joined by faith leaders. Our next Climate for Health episode will be co-hosted with the Environmental Defense Fund, and we'll dig into some new research on climate change, air pollution, and health equity. Sign up for the Climate for Health newsletter so you don't miss a beat. From all of us at ecoAmerica and Climate for Health, thank you. Please join me in caring for our climate in order to care for our health. Stay well, stay safe, and see you next week.